that thing, let it clap, let it clap. Ride this, eat 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 this. Ride this, eat 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 this.
You are now listening to Receipts Denied. Welcome back.
Welcome back.
Hey.
Another week.
We had a week off
We did have a week off.
because of my birthday.
It was your birthday.
I probably got weighed. I just did a lot. I
Girl.
overexerted. I'm pretty sure I overexerted. But honestly, because I don't think I've done something every single day, and that's the first time I did something every single day. the
I mean,
week
that's a
leading
lot.
up. Yeah, like literally went to King Spa
Mm.
on
Oh,
Saturday. I don't recommend, but
Yeah, I
you're
heard.
like the 1,000th person I heard say that.
Yeah.
not interested. And then Sunday I went to try a new restaurant. Monday I tried a restaurant. Tuesday I went to dinner, tried a new restaurant. And then Wednesday
This was all in Northern Virginia or here?
No, here.
Oh, okay.
And then Wednesday I went to Northern Virginia to try the actual place on my actual birthday.
Oh, where did you go?
Capitol Grill. Amazing.
Oh, yeah. Capitol Grill is
Oh my
scrumptious up there.
How
God.
do I remember that?
It
Have I been
was-
there before?
I don't know, but they have one in Fairfax and Tyson's.
Yeah.
It was so good.
Yeah.
Like, hands down, so good.
Yeah.
And they like wrote me a birthday card. It was very nice.
You
Like,
ate by yourself?
oh yeah.
Oh, nice. Okay.
Yeah, I
Little
enjoyed
solo.
it.
Sweet.
Obviously, I prefer that because I can get what I want, try what I want, leave when I want. Only
Mhm.
bad part, it was raining.
Oh,
Mhm.
okay.
Yeah, but it was a good day. Good
Oh,
drive up.
good.
Yeah. So, we're back,
Yeah.
Mhm.
and we have a special guest
You
today
do.
for our topic. Hi, Jasmine.
Hello.
How you doing?
I'm here.
Yeah.
Yeah.
I made it another day.
Yeah.
Yeah.
Yes.
Well,
yes.
we're gonna get into it. I'm Melanie.
I'm blue.
I'm Ashley.
All right, and our topic today is Black women, Black men in healthcare.
Yeah.
Mhm.
And kind of the stigmas related to the struggles that it takes just going to the doctor or getting to the doctor, getting
Mhm.
yourself there. So,
And the struggles once you get there.
oh
Yeah.
yeah. And it sucks because once you get there, some of those struggles shouldn't really be things, and then they turn into things.
Yeah.
Mhm.
Like if I tell you I'm in pain, don't tell me I'm not. I'm in
Yeah.
Yeah.
pain, you know? So we're gonna get into our hot takes.
Okay.
And what are we talking about today?
So our first hot take is about Serena Williams and her birthing experience.
Mhm.
We know that when she was giving birth, she noticed something didn't feel right. She said something to the doctors, and initially they were brushing her off, but she was persistent, which you do have to advocate for yourself.
Yeah.
She advocated for herself, and in turn something was wrong, and it could have been detrimental, even fatal, if she didn't, speak up and be persistent about,
What it
them
was.
listening to
Yeah.
her.
And the
Yeah.
crazy part is with her that like was shocking to me. She has money.
Yeah.
So you she wasn't in no regular hospital with no regular doctors, and they weren't even listening.
Yeah.
Yeah.
And she was like, I felt these things in my body. I knew something was wrong. I knew it wasn't normal, and they weren't listening. And I think it was like blood clot related, something
Mhm.
that could have, I guess, hit
Mhm.
her brain and killed her.
Yeah. I mean, blood clots are
Yeah.
serious. You cannot joke around with
Mhm.
blood clots.
And so I think it's crazy that, and then, the regular people like us, we go to the doctor and we got to do everything but plead to get basic help.
Yeah.
Childbirth is already scary.
You remember the not too long ago how the couple went and the girl was basically she was in active labor and they turned her away. It was a Black lady.
Oh, wow.
They turned her away and she ended up having the baby, I think, in the car.
Oh, yeah.
And they end up suing
She
because
sued.
they turned her. The one was they turned her away, and then the other one, it was a lady in there, and her
Midwife.
midwife was there, and they made that lady leave.
They made the midwife leave?
Yes, and all these people were people of color, and both of those hospitals have lawsuits now
Wow.
because they're doing something weird, and we've always heard it when it comes to us that they treat us totally different.
Yeah.
It was a
I haven't
documentary on
experienced it
yeah.
at all. I have 4 kids. I didn't experience any of
With
it.
childbirth, have you experienced it with regular health?
Like just
stuff?
out here. See, I haven't. I can't say that it's race based, but I have experienced where you go in and you can clearly see they're just trying to get through your appointment. Like they're not really engaging. Like I was sick at the y'all remember when I had that cough?
Mhm.
Oh,
I
thank
had this
God. That
lingering
is
cough.
gone.
For like a month or 2
No,
months.
it was literally like 4 months.
It was a long
It was
And
a
she
long
was
time.
coughing.
So whenever I get sick, I don't get sick often, but when I get sick, usually the cough is what lingers the longest. So, but usually it's like 6 weeks. So the cough is still going on. I'm like, all right. So I go to initially I went to my PCP, and then I went to an urgent care, I went to my PCP, and then I went to an ENT. But
Mhm.
before I had went to the ENT, I was just really coughing. So I was like, okay, I'm just going to do a walk-in at this clinic. So I went, and literally the lady came in and she was like, so you say you have a cough? I was like, yeah, it's been persistent. Like, she's like, is it productive? Like, do I cough up phlegm? I'm like, no, it's just this dry. It literally sounded like a smoker's cough.
Mhm.
And she was just like, yeah, it's not really much you can do. She was like, you can take some Delsum.
Wow.
This is
Wow.
literally how she was talking to me. And I was like, I could have saved my $20 copay that I just paid and just got the Delsum. Like, you didn't even like touch
Need
me,
to,
nothing.
right, check.
Yeah, at the end she like did the thing where they take the stethoscope and
Listen to
listen to your
you.
lungs. Yeah, breathe in, breathe in. Yeah, your lungs are clear. She was like, yeah, you can just take some Delsum. I was like, well, all right.
Well,
And then you had to go to another doctor.
Yeah, so then I went to the ENT, and I mean, he was really good.
He was really good, or he just was better than the Delsum?
Well, he was definitely more personable. He was very knowledgeable. I mean, he did more because he did the scope like down through my nose, down into my throat,
Mhm.
and he, explained everything that was, what he saw, and I mean, I think sometimes they be shooting in the dark because he was just like, sometimes because you're coughing, it can make you cough
Cough
more.
more. And you were like, you were saying that, and I was
So
like,
I was like,
huh?
and at this point, I've had this cough for months. So I'm like, I am tired.
Look,
You talk about I'm
she would be
coughing,
on the
so I'm
podcast like, hold up, pause.
No, literally, because I would be over here like trying to hold in this cough because it was persistent. It wasn't like just a cough every now and then. I was coughing.
Mhm.
It was very prevalent. So I was like, is something wrong? But yeah, they said, I didn't have any fluid in my lungs, nothing. It was, he said, your throat looks great. I don't see anything going on. But he ended up giving me the omeprazole, the acid reflux.
Oh,
Like
okay.
that's what people take for acid reflux. But he was
Oh.
like, they use it as like a cough suppressant too. And it worked. I took it and it went away finally, thank God.
Thank God.
But yeah, that lady, I still haven't forgot her because she made me upset. And it was another lady.
Because you had to pay a copay.
Yeah, I'm like, I paid a copay for this. Also, when I got something in my eye one time, the lady was so rude and nasty to me. I was just appalled. And she like scraped it. She was trying to scrape to see if there was anything on there. She was like, "There's nothing on there. I don't see anything." And my eye is on fire. It's swollen. And
so what you're feeling
so
does not
yeah,
matter.
she was like,
Yeah.
"You can follow with the Eye Institute." So I was like, "Okay, like, do you have their like contact information?" She said, "You can Google it."
Oh.
And she left out the room.
Yeah, do all the work.
Oh
And my eye was on
gosh.
fire after. Like I couldn't. The light hurt so bad because she had then made an abrasion on my eye. So I was like sitting there with my eyes closed, and the nurse came, and the nurse was so sweet. She was like, "I'm really sorry. Like, I can really see that, you're in a lot of pain." And I was like, "I am." Like, I had to put on sunglasses.
And those things make you like, why did I come?
Right.
Yeah.
Not just why did I come? You didn't make me feel any better when I'm leaving.
Yeah.
So that puts a bad taste in my mouth for maybe that's the only place. Maybe somebody lives in a rural area and that's the only
Yeah.
place that they could go to. Now they have a bad taste in their mouth. So what are they going to do? Sit at home
Yeah.
Yep.
and just be in pain,
That's very true.
which
Yeah.
is so crazy. Like, I mean, we deal with these things all the time. Obviously, we know childbirth rates are up. We also know that there's been so many studies where they say Black women
Yep.
are overlooked because we handle pain better.
Yeah.
And I was reading something about childbirth and pain. And apparently back in the day, back in the day,
Mm-hmm.
they used to test Black women's bodies to see how much pain they could go through. So they would do doctors would do all these testings on them so that they knew how to handle the white women's bodies
And I mean, I'm not surprised.
at all. They would have had to kill me. I'm
Yeah.
sorry. Go ahead and put me on the tree
Yeah.
and hang me.
Well, first of all, when they tried to test me, everything would hurt. Ow!
But you know, they would,
Oh, I can't take it.
they would like sterilizing a lot of, Black women.
Yeah.
Yeah, like, so, I mean, that was a whole nother thing.
We're going to
but-
get into that because I feel like they still try to indirectly sterilize us.
They do.
Yeah. So,
Sterilized.
yeah.
It's crazy.
Our other hot
Or is it
take,
euthanize?
euthanize. Don't sterilize.
Okay.
I was like, they
They do to the
killing
dog.
us.
They kill a dog.
I was like,
They took us to a dog shelter, animal shelter.
But you're right. They do try to do that to us.
some way, right?
I was like, euthanize.
Our next hot take is the couple that had she bought the $47 dress for her $500 wedding, and she went viral for it. She just died from childbirth.
Unfortunate.
Newly married, her and her husband have this kid, and now she dies, and her kid is in the NICU apparently still.
They said he's making progress.
Yeah, they did say he was making progress, and you just hear these things, and it also makes you like, do I want to go through that?
Yeah, I mean,
Potentially.
Yeah.
But they, people talk about it too, like childbirth, because it happens so much, it's seen as run of the mill, but childbirth is a major event. Like your body going through all of that and all of the complications that can happen during, like it is very serious. But
Yeah.
because it's like, oh, how many, so many people pregnant and they've given birth and, it was nothing. No one takes it as serious as it really is.
Yeah.
Especially when you're doing C-sections. Like, I mean, was it somebody I knew? I'm like, was it one of my nieces or when they cut deep and they cut the baby. Yeah, the baby had a cut
They didn't sue?
on them.
That definitely should have been a lawsuit.
Yeah.
It was one of the doctors, I believe. Yeah, I remember my kids are in their 20s now. Black African guy.
He was a doctor?
He was a doctor here in Richmond, and I want to say that's how he lost his license because he did exactly that.
He cut the
Oh
baby.
my
He cut the
God.
baby. He went too deep.
Yeah.
Like, good.
I couldn't imagine. I didn't have any C-sections, by the way, but I couldn't imagine.
Yeah.
You cut my child?
Yeah.
When did you get your license?
My first niece, well, granted, she was stuck.
Girl.
So they had to be rough, but she got stuck in like the birth canal. So they had to like force her out. Like they were pushing on her, like my sister-in-law's stomach and like yanking on her. So when she first came out, her whole arm was bruised. It was black and blue. Yeah. Cause it like got lodged, like her shoulder is what kind of got stuck. So they were like having to like rip her out of the birth canal.
And they
her
do
arm.
have to get physical. With Kayla, they had to use tongues. And they looked like they was tossing a salad when they were trying to pull my baby out.
They was tossing
Because I was looking and I'm like, what are they doing? And they were doing like this. And they were like, push. And I'm like, I can't. Like, I could not push. And they were doing it when Kayla came out. She had two little knots right here. But she had so much hair. You couldn't see it. But me as her mom, she had two little knots from when they was using the tongue to pull her out.
Yeah.
So I've had 3 C-sections.
Oh, wow.
Because once you have one, you have to have,
I would try to do a vaginal for my second, but my body just was not, it wasn't ready for that. So for my third one, it got so long in duration and they're trying to yank her that I started to feel stuff. So they had to put all these other medicines in me, monitor me and stuff. And it was like an hour plus later until they got her out and she had to go to
And a C-section?
a C-section.
Oh,
Because shouldn't a C-section be like
bad?
It's supposed to be
it shouldn't be
easier.
that long.
That was your third child,
my
you
third
said?
one, yeah.
How long was it
Jesus.
with your first?
Oh, my first one was traumatic. So my first C-section, they were trying to send us home. My water broke. The doctor tried to tell me my water did not break. And I was like, I know my body.
Yeah.
You know, like something's not right.
Right.
And so I'm hooked up to the machines. They're watching, baby's heart rate. And with every contraction, his heart rate was going down as well. And so my husband's like, y'all aren't sending us home. like something is really happening. And so I remember the doctor was like, well, you finally got what you wanted. And
Oh,
I'm like, to this
Lord.
day, listen, I remember that man's face 14 years later. And I'm like, that's not what I wanted. You know, like I wanted a healthy baby.
healthy
Yeah.
baby.
Are you
So
crazy?
they were pushing the C-section. That's what I felt like. I
Oh,
felt
to
like there
not
was a
have
push.
to.
Yeah.
Mm.
Yeah.
I just got
Easier.
mad.
Yeah.
I
To have a
just got mad.
C-section, you know, just to cut me,
Jeez.
versus a natural,
Oh,
vaginal birth.
Dang, that's
Yeah.
so crazy.
Yeah.
so crazy.
Yeah.
I mean, I can only imagine. That is always one of the things I think about. And it's like, do I want to go through all that? Because the second you don't listen, then I'm also now getting pissed,
Yeah.
which also creates stress,
Yeah.
which is stressing my child. Like,
Mm-hmm.
then I want to now find out where my gun is, and I don't even have no gun. But that's what, you know what
It's
I'm
a
saying?
thought
Like,
process.
you're really now going through all of this at the same time. Your body's also going through something.
Yep.
And I don't think one, we acknowledge enough of what women go through in general, all
Yeah.
races, to have children. But then to come and say, well, there's high maternity rates of people that's giving birth in the African American culture. Why is that? It's not because we're going to different hospitals. So then you start to realize, like, okay, so when I say I'm in pain, it just doesn't matter.
Mm-hmm.
The same way that if a white woman comes in here and yells, she's in pain. Same way we do if a white woman's on the street saying that somebody's attacking
Yep.
her. But if a black woman's on the street, it's like, somebody was attacking you, prove it. You know what I'm saying?
Yeah.
So I think society has made it just harder for us to be in rooms even when we need help.
Mm-hmm.
Mm-hmm.
Which is why I think this topic was necessary, because of the fact that, like, there's a lot of people that don't go to the doctor now because of whatever reason. They have white coat syndrome, where they're scared, or, somebody else's story was too traumatic for them, all these things. So I just think it's like, it's crazy with childbirth, but in general, like, obviously we gave two topics that are like big in media. The girl that just passed, that was like 2 weeks ago or 3 weeks ago, but we're talking about it now. Her husband's without his wife
Yeah.
And a newborn.
and a newborn that's still in the NICU. So, and now it's like, I'm sure he's on edge.
Yeah. I mean, that's a lot to contend with all at once. So
Because also, are you treating my baby right now? Like,
yeah.
is that something I need to also be worried about at the same time? So, but yeah, we're going to get into the topic though.
So Jasmine, tell us a little about yourself.
Yeah, so I'm Jasmine. I am a mom of 30. Right now, my kids are all kind of like in different stages of life. So I have an elementary school, middle school, high school age student. So being a mom is not my identity, but it shapes a lot of just how I function, from day to day. So while navigating, mom life, I'm also in school full-time for my computer science degree.
Oh, go girl.
So I should be expected to finish that over the summer.
Congratulations.
And I consider myself an elder millennial. Okay.
As an elder millennial. Wait, why you consider yourself an elder millennial?
Oh. Listen, I'm like, I don't care what y'all say. But like going back to school after not have been in school for such a long time is hard.
How long was your break?
For school?
Yeah.
I haven't been in school since, oh my gosh, 10 years.
Oh, yeah.
Okay.
Because I've tried to go back to college, and there have just been so many things in life between kids, marriage, whatever it may have been, that I'm like, I can't do that right now.
Yeah. I mean, it's hard. When you get into the swing of life.
It's
And like your motivation start to change.
It changes.
Yeah.
Because at this point, a formal degree, like,
I want to go back.
certainly.
Give me
If it's not a certification, I can't do it.
Okay, that makes sense.
I can't do it. Like, this brain, I can barely remember what I said 2 seconds ago.
No, seriously.
Give me back.
So I don't even think I would be able to make it through like any type of formal.
Yeah. But we have so many things for our brain now that we maybe didn't have, that we're thinking about. So sometimes I'll be like, what just happened? And I'll run upstairs. I'm like, what did I come up here for?
This is what I'm saying. And that's literally
Go back
me.
down. But at the same time, I could go back to school now.
I would have to be on 100 milligrams of Adderall.
Give me that.
100.
So, 100 is so
This brain, woo.
No, that's very severe.
yeah, 100 is so severe.
That's
once
Ash.
you-
Ash, you see
I
me,
think
Ash?
once
That's what
you
that
get
is.
into it,
It just
it
becomes
just comes
natural.
back. It's like
Yeah.
diabetic.
Okay.
You know, like
Okay.
once you get back into the routine of it. But I think having my kids and what they teach them now is not what I learned.
Nope.
So
Right.
like this Common Core math and all the steps, I'm like, baby, like I got to look at a YouTube video.
Yeah.
So I feel like that has helped me, just to kind of keep it going.
Do you think it's better now though because AI was
No.
introduced? Oh, it's worse
For like just school in general for my
Mhm.
kids or for me?
for school for you in general? Because I feel like if I'm going back, I get to have some AI guided. As opposed to when we was in school, like after high school, it's not AI guiding
It wasn't,
you.
but we had better thinking skills. Like these kids have no critical thinking skills.
They
Like,
don't.
They have no resilience.
They
They
don't.
no common sense because
Nope.
everything is given. Like when you think about it, like ChatGPT is scary.
It
Like it's
is.
actually scary.
It is.
Because if you talk to it enough, it starts to learn how you speak.
Speak, yep.
It like you can have full on conversations. Anything you put in there, it has an answer back.
And mine was getting smart with me the other day, so I don't even know.
Yeah.
What did you say to her, though?
Mm-mm.
What you say to her?
I was telling her I was doing my food journal.
Oh.
And she was like, you already told me that.
Wow.
I said, wrong day.
You got it wrong.
You got the right day. Then she was like, I'm sorry. I noted that day. Yeah, like, why you getting smart? Like, now you get me annoyed. Because I'm like, I pay $20 a month for you. I pay $20 a month for you to be getting smart.
That is funny.
Stop. The problem with AI is that if you have any lick of sense, they think that you have used
AI.
as an
Yeah.
assistant.
Oh, yeah.
And I'm like, I just can't write. Like, I have
Regular.
to, show my proof of writing, recorded, my whole
Oh,
process.
wow.
So that I don't have to worry about being accused of AI later down the road.
Yeah.
So if I don't dumb down my work, then there's that possibility of, oh, did you have someone help you to write this?
Wow.
Wow.
Yeah.
Wow.
So that is something that I haven't run into, but I always make sure, I covered all.
Yeah.
Because I've heard.
Girl, that's stressful.
That's
It's
crazy.
stressful.
That is stressful. I would be like, I don't care, accuse me.
And
of
I
AI.
feel for the people who actually really have to depend on AI because what
Yeah,
they doing.
because some of them definitely do.
Yeah.
Mm.
So, but so we brought you on because what people don't know is we went to high school together. We graduated the same year. And after that, you just, you see people on social media and your new page popped up.
Yeah.
And maybe we're going to go into what that was, but I want you to be able to tell why you think it was important for you to join today's conversation.
For sure. So my goal today in joining is that I want people to be seen, right? I want people to feel like they're heard. I think a lot of times when we are navigating just like this space, especially with, struggles and illnesses, that we feel isolated, we feel alone, we feel like people don't understand. And so my, I guess, desire in my heart is that if I can share the things that I go through, that someone just like gets like an ounce of hope, and they feel like they can get through that. Because I know what it feels like, to go through a very heavy season of where you feel like, you were drowning
Gotcha.
and you just feel alone. So I just am like, let me share my story. And I believe sharing is healing.
Yeah.
Because we're not meant to do life alone.
I say that all the time.
So good.
Community is so important.
I'm just hoping that, being transparent and sharing just helps someone else.
Okay. So I was on your new Instagram.
Yeah.
And it was talking about lupus.
Yeah.
And so I went, like everybody else to see what is it about?
Yeah.
And I was like, oh, wow. So tell us a little bit about that.
My lupus journey.
So you do have lupus?
Yes.
Okay.
I do have lupus.
Okay.
I received an official diagnosis last year.
Okay.
April of last year. But this is something that has affected me for the majority of my life. Mainly when I first got married in 2010, I started to have like these symptoms. And for me, the symptoms started in the form of a rash. Okay. And so I remember I went to patient care, patient first. They looked over me and they told me it was a fungal infection. That doesn't sound right, but cool.
Yeah.
I'm young.
Anything to say young.
Right. I'm young. I'm newly married, so I'm like, okay, well, cool. And so it went away by itself.
Okay.
Right. And so I was fine, life was great. And then I started having these very just odd symptoms once I had my third child.
Okay.
So this was around COVID. And I realized I just felt off, right? My mental was just not in a good place. I felt like I didn't even recognize who I was as a person, right? And so that's kind of how it started for me. And then my body, my physical body had rashes. It had just random scars, blisters, cold sores, just weird things, right? And so
everywhere, on your body,
it's
or
mainly on my face and my neck.
okay.
So that's for me. That's how I know I'm in a flare.
Okay.
Yeah.
I have just random scars and random bumps on my face, random bumps on my neck, and everything starts to tighten. My muscles, they lock up. I can't walk. I'm using crutches, to kind of get around and stuff. But as I was having these symptoms, I'm talking to my doctors.
So
and
this
they're
10 years apart.
Yes. So lupus can go into remission,
Okay.
right? And for me, I think what kind of triggered that was stress. But COVID was just a very stressful time. And I just had a kid as well. And so I think just all of those things compiled and it just sent my body into this frenzy. But unfortunately for me, my hormones were blamed on why I was experiencing these
Because you
things.
just had the baby.
Exactly. And I'm like, this is my third kid. I know every single pregnancy birth is different, but something's not right.
And I know my body also.
Exactly. I know something's just is very off. And so they kind of chalked it up to anxiety. And
Wow.
so they're like, oh, you're just anxious, you'll be all right. And
What
I'm
about
like,
my blisters and rashes?
it's just life.
That's so crazy.
They had nothing because I'm too young, right?
They always
I'm
say
And they
that.
have to
right,
stop saying these things.
Exactly. And then coming out with things later on talking about women need to start getting checked for this at 25.
Exactly.
But you keep saying we're too young when
young.
we're coming in
Right.
and complaining
Because
about
even
it.
now with the and not to get too far off, but mammograms.
Yeah.
I'm like, there's a higher I've had numerous people in my life, in my age group, in my friend group, that have had breast cancer.
Yeah.
We are young.
Yeah.
And I'm like, the fact that you guys haven't bumped up the age to 30 for when you get your first mammogram is insane to me.
Yes.
They tell you if you have the gene, though, you should get it earlier.
But they also will reject you. My OBGYN told me, hey, I see you have a history. My dad had prostate cancer. My mom had breast cancer, right? So I have it on both sides. My doctor now, she's the one who started putting in the orders for me to get them way more often than the average person. Prior to that, they wouldn't give them to me.
Oh.
And I'm like, this doesn't make sense because this very much so may be an issue for me.
Yeah.
But when I got to this new doctor, she's like, no, whoever that was, they were wrong. Hey, I'm going to put an order in. And she sends me often.
Which is when they say no, I'm like, are you saying no because you worry about my insurance and you worry about me getting a bill? Or are you saying no because you just saying no? That's what I can't stand.
Yeah.
If I'm asking you for something, it's not like I'm in here asking for oxys and Percocets.
Exactly.
I'm asking for testing to be done
Right.
pertaining to.
But you know what mine was? You're so young. I'm so young. But my mom got breast cancer at the age of 20-something.
Did she have the gene or did she?
I don't remember. I just remember I was in middle school and my mom had breast cancer. She had the surgery, but part of it was her breast was taken off. And I remember it coming back. She went on remission, it came back. Hence, she didn't die from cancer.
Right.
You get what I'm saying?
Right.
So it was really in remission. But if I'm telling you, hey, my mom has breast cancer, she was diagnosed in her 20s. And my dad was diagnosed with that later in life. But I now have this on both sides. I don't know if it was genetic, what it was, but
I need to get checked.
you're looking at my file and you see what it is, and you're saying, oh, no worries. No, yes, worry. Let's worry.
Right.
Yeah.
Like,
Yeah.
and not even to worry, but if I'm asking you for something, give it to me.
Yeah.
Now I get it on a regular, like I supposed to.
That's good.
They check me. I don't know what someone without a risk, how many times they get checked, but I know I get checked on a regular. Like,
Okay.
I don't know if it's once a year, twice a year, but I
Normally
get
it's, I think, once a year, but if they feel like you're at risk or see something, I think they do every 6 months. Sometimes
so
every
I'm
3.
like in that range.
Okay.
By the
Okay.
grace of God, they have never seen anything.
Well,
It
that's
always
good.
comes
That's
back,
good.
you know.
Yeah.
So, but you're right that they need to change that.
Yeah.
They do.
They do.
They do. So with lupus, is there something where, you know, people should get checked at a certain age? People should be getting checked.
I mean,
Is
is there
there
really even a way to just get checked for
checked?
lupus?
So lupus is an autoimmune disease, right?
Yeah.
So with me, all of my blood work came back normal.
Mm.
I mean, stuff like you're healthy, you're
Yeah.
young, everything came back normal. It wasn't until I requested some further blood work and my antibodies came back positive.
Oh, okay.
But the thing with lupus is that even with a positive antibody test, that still doesn't mean much to them, right? So I had to, even though that was a thing that came back, hey, there's possibly something going on, I still had to fight in order to be like, hey, I need to see a rheumatologist. Because lupus is actually very hard to get diagnosed.
Yeah, because I'm like, I feel like I've known people, well, I've known a few people with lupus, and um it just seemed like it was a journey for them, like a whole thing
Yeah.
Yeah, I
to
know a few people
get
too.
to a
Yeah.
diagnosis.
It's not just like I walk in, walk out.
But do you feel like you got to a diagnosis later in life because people weren't listening? Or you feel like it would have maybe turned into later in life just because of how things were like showing up for you as far as the like
Yeah.
signs?
I think it would have just turned to later in life just how things were.
So you feel like they listened when you went to the doctor?
I think so, but I'm basing that upon myself. I was young, right? So I think if I would have known differently, I would have did differently, when I was 20 something. So I didn't know what
You
questions
think you
to
would have
ask.
pushed a little more?
Right. So like I feel like for me at that time, they did what I asked them to do, right? Because I
Okay.
didn't know what
Like with the
happened
first time with the
was. Yeah.
rash, like it was a
Right.
rash,
And
and
how
you had
long
no
did the
other
rash
symptoms.
last?
That lasted for about a month.
Wow.
I had just started a new job too, so I'm like, it
It could be
probably is
stress.
just stress,
Yeah.
right?
Mhm.
Like I'm stressed out, newly married, start a new job, out on my own. It's stress.
But
Yeah.
that's always our go-to.
It is.
When that's not a diagnosis
It's
of
not.
health. Like,
not.
Yeah.
yes,
But
we
stress
are
can
stressed.
cause physical things.
It
though.
can, but it's showing the physical things, in my opinion, that's in your body. Like
Yes.
Mhm.
when my shoulder is burning, I know that I'm
Yeah.
stressed,
Yeah.
but
It could be
my
something
shoulder
else.
still shouldn't be burning.
Yeah.
But, obviously I'm carrying stress.
Yeah.
But I feel like when things manifest as like rashes
Mhm.
and like flare-ups, like yes, our body is stressed because it's being overworked, but it's still showing us what's physically wrong.
It's like
Right.
an underlying
There's
Yeah.
a
thing.
root to it.
Yeah.
Right. Right.
Yeah.
Yeah. And
Okay.
so
So you
when
went back to the doctor and you switched doctors though, didn't you?
I did.
Okay.
So I went to the OB.
Okay.
Because I was having, my flares were linked to my menstrual cycles.
Oh.
Wow.
And so I noticed for a few years, actually, whenever I had my menstrual cycle, my body would just feel like it was on fire,
Mm.
right? And my hormones were just like out of this
Mhm.
world. And so I was talking to the doctor, and she was just like, "You're fine."
Mm.
And I'm like, "Okay, cool." So I got another doctor
Yeah.
at the same practice. And she
Ooh,
just
petty. I love
the same
it.
practice. And she told me her response was, "Well, you can't listen to everything you see on Facebook." And I said, "Pause.
Yeah.
I'm not on Facebook, first of all, right?" And I was like, why is it that my opinion is not respected?
Yeah.
And I
You're the expert on your
On your body.
right. And so then I asked her, I was like, "Well, do you have experience dealing with Black women and lupus?"
Was she
According
black?
to the no, she was not.
Mm.
Oh.
According to the textbook, and I said, "Oh no, you don't."
Yeah.
And so I said, "All right, we're good." got another doctor.
Mm.
So this is my third doctor at this practice, and I finally found someone who actually was willing to listen to me. Because again, with lupus, your hormones and the fluctuation of your hormones can affect you and cause you to have those flares.
Yeah. So at this time, were you asking them like, did you think it was lupus, or you were just trying to figure out what was going on, like something?
Yeah, at that time, I knew it was lupus.
Oh, okay.
Okay, so you were
So,
diagnosed.
yes, I was officially diagnosed at that time, and I was trying to find a remedy for my cycles.
Okay.
So I actually ended up having a hysterectomy in
Oh,
January.
wow. Okay.
Yes, that is
Oh.
something that I chose to do,
Mm-hmm.
and it has been a saving grace for me.
Oh, well,
Okay.
thank
Completely.
God.
Well,
Yeah.
that's good
Yeah.
that it
Yeah.
worked. And it's also good that you have your children.
Yeah.
Yeah.
Because trust and believe,
Yes.
when I was told that I needed a hysterectomy and I said I wanted kids, I told the
Yeah.
doctor I wanted
Yeah.
kids, and this is a man doctor.
Yeah.
So because I suffer with fibroids, and my fibroids aren't like what I hear people's stories.
Yeah.
Mine
Yeah.
just makes my stomach look larger than it is.
Yeah.
Mhm.
I don't have pain. I don't have bad menstrual cycles or any of that. So when I went into him, it was just to see what remedy we could do for the fibroids. And this man said, "Oh, no, ma'am, get a hysterectomy
Oh,
now."
Yeah, that's
wow.
crazy.
Yeah, no.
And I said, "We talked about this. I
Yeah.
told you I wanted children.
Yeah.
So hysterectomy is not a
Mm.
solution."
That was
And
your GYN?
no. So my OBGYN or my GYN is separate. The reason why I was going to him is because he specialized in like fibroids and telling you
Okay.
what you can do with it. So, and my sister had already been to him, but his thing was get a hysterectomy, which is not shocking
It's not.
because I hear that that's why I said making us sterile.
Yeah.
I hear
Mhm.
that that's like their
Yeah,
solution.
sterilization is a thing.
Yeah.
Yes.
Get a
is,
hysterectomy,
yeah.
don't procreate. I don't like that's the vibe I gave.
Yeah.
I'm
Mhm.
telling you I want a child and that's your solution. Now, all the other things, you didn't say, "Oh, your eggs are,
Right.
bad." You're not saying those things. You're just saying, "Oh, you have fibroids? Hysterectomy."
Yep.
When that's not a solution. And that's what ended up getting me to UFE, which helped with like fibroids.
Mm.
So,
Yeah. For me, it was I could do birth control. What is it? The IUD,
okay.
all of these things. But I've tried these things in the past. I did, birth control did not work for me. The levels just they don't. My body rejects it,
Mhm.
right? And so I'm like, I'm not gonna keep introducing these things to my body and be an experiment. So I'm like, I want a hysterectomy.
Mm.
I got my tubes tied 5 years ago, so there was
Okay.
nothing like
I want
had
another kid.
right.
Yeah.
Like I knew I was done.
Yeah.
And so at this point, I'm just like, take it. Like, I am tired of being miserable every single month.
Yeah.
3 weeks out of the month, like, I'm in bed. I can't move. I can't do anything because my body's in the flare. And I feel like
Jesus.
that's not a life I want to live.
Right.
Mhm.
Like,
Right.
I can't do that. I
Yeah.
have things that I have to do.
Yeah.
So I finally found someone who listened to me, and she was like, I don't understand why they just didn't take the time.
To
And
listen.
I'm like, yeah,
Yeah. And
you
that's a
know,
small thing.
it
It
is.
costs you nothing. You're
Nothing.
already in the room with
Yep.
me. So the least you could do is just listen.
Yep.
Yeah. And you're
Yep.
getting paid good money to be here.
That's what I was about to say.
100%.
You
Yeah.
signed up for
Yeah.
this.
Exactly.
And you're
Yeah.
getting paid multiple times.
Yeah.
And the
So,
thing is, they take the oath to do no harm.
Mm.
Like, so you need to really listen and take heed to what your, patients are saying. And I just think spectrum now, bedside manner is just not
Yeah.
really there.
oh my
Like,
God.
they're just kind of checking off the box. And I get it. Like, post COVID, was very overwhelming on the, healthcare, like, doctors, nurses, and whatnot. But you still have to do your job and do it to the best of your ability and really listen and make sure your patients are heard. Like my GYN, love her to death. That's my girl. Like she listens, like she comes in the room and like before she even starts, she's just like, "How are you?"
Mm-hmm.
Like
Yeah.
she sits
Have
down
one of
and
them
like
kind of, yeah.
Mine is great too.
Mine's too.
and yeah. So I'm like, I don't get that a lot with doctors. Most of the time they're just like come in the room, barely look at you, washing their hands, like, so what's going on? And then, just kind of going through the motions and then you're out. And it's just so unfortunate that that's how it is.
And those
Yeah.
normally are our longest doctors. Those are like the ones we have the best relationships with because we've had them for so long. Because
Yep.
I've had mine since I was 18.
Yep.
So
Yeah, see, I got with mine, it's been maybe 2 years now. My old GYN, she was actually an older Caucasian lady, Bonnie. She was my girl.
okay,
She was my girl. Yeah, I was devastated when she retired. But then after that, I went through a couple, and it just wasn't really my cup of tea.
why wasn't it?
I felt like it was, I was going through some personal things at that time, and I just felt like I wasn't being listened to,
Makes
and I was being brushed off. And I'm like, same thing. I was asking for something simple at the time, and she was like, "Well, there's not really much research on that."
Research.
I don't care.
So
Like, it wasn't going to be something that was harmful
right,
for me.
right.
And she just was like, "Yeah."
Wow.
And then she was like, "You can go to this doctor. You can refer out to
Oh, they're
this
gonna refer you out,
if you
child,
want
when
to
they don't want to deal
explore
with
that."
you.
And I'm like, you could have easily just given me a script for what I was asking you for.
And then that creates a narrative when we are like really aggressive about like our health, then all of a sudden we're angry Black women.
Yeah.
When really, I didn't come in here angry. I'm not yelling at you. I'm just trying to get answers. And instead, you want to refer me to somebody else because you don't want to deal with me.
Yeah.
Yeah.
So, I mean, the health thing is crazy. I think, especially with your journey, that took a long
Yeah,
time to get to. Good thing that we didn't hear, though, that doctors were brushing you off as much. Because I guess when you found out you had it, then you got brushed
Yes.
off.
And it was good that you we're cutting these people off, moving
Yeah.
on.
Oh, for sure.
Like,
Yeah.
all right, peace.
Yeah, because
See you later.
so now that you have the hysterectomy, do you have to do like a hormone replacement or anything?
No, I don't.
Oh,
So I
wow.
cut my ovaries.
Okay.
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 And that was very important to me because
Okay.
I'm like, I don't want to go into like, premenopause, surgical menopause.
Yeah.
Right now, though, I'm just still dealing with my hormones leveling.
Okay.
That's a process.
Mhm.
But again, like, I feel like I am me again.
Oh,
I
that's
feel like I
wonderful.
have
good.
my life back,
Yeah.
I am doing all the things. I don't have to plan, around what my cycle is or
Yeah.
anything like that. But I don't have those pains,
Yeah.
So I feel like my quality of life has improved.
Which is good.
Right. So quality of life improves, mental, physical, spiritual, all
Yeah,
of those
all of
things
it.
improve
Yeah.
with it.
Well,
Yeah.
that's amazing. I'm
Yeah.
happy to hear that for you.
Yeah.
Okay. So yeah, Jasmine, are you on, did you have to take any medications now?
Yes, I am on medicine for the rest of my life.
Oh, wow.
Yes. So I have to take Plaquenil twice a day. And it took about 6 months for that to actually start working, but that helps to manage like the inflammation in my body. Because there are 4 different types of lupus, and the
Okay.
one that I have is systemic lupus.
Okay.
And so essentially, my entire system is attacked. So with this
Oh.
medication, it preserves my organs, specifically my liver, to make sure that stays intact and that is not damaged. So
Wow.
I take medication.
Yeah, I didn't know they had different kinds of lupus.
I thought it was all the same.
Yeah.
Well, that's good education
Super
for
close.
us.
Yeah.
We love good words when
That
we
is
learn
so
stuff.
crazy.
Yeah.
And how do they determine which one you have?
Your symptoms. It's really just a matter of your symptoms.
So
And
they could just be
so
making it up though too, couldn't they?
they could be. Yeah,
Okay.
but it resonated when they said what they said. I said, okay, let me do my research. That
Yeah.
sounds good, right?
Mhm.
But because some lupus is literally just physical. So, like with the rashes, some people that is literally the only sign they have lupus is by the rashes. With the systemic, it's a little bit of everything.
Mm-hmm.
So I have a little bit of everything from every little pot, and it makes it a bit harder,
Mhm.
because it's not just, my physical being attacked, but it's neurological, like
Yeah.
that even during flares, I have brain fog, I forget words,
Girl, I
anxiety.
feel that, and I don't even have lupus.
Jesus.
Yeah.
There's a lot of different things that play into it,
Mhm.
it's not just like a one size, I guess, fits
Fit
all.
all, yeah.
Yeah.
Yeah. So my lupus can look completely different, than somebody else. I am mobile, I'm able, and somebody else can be in a wheelchair.
Yeah.
We have the same exact diagnosis.
Because
So,
Toni Braxton has lupus,
yes,
and I think she was like, I can't be outside and
right?
I need to, cover up. And I didn't understand it because I was like, is it a sun thing that's like bothering her?
Yes.
Okay.
It is sun exposure.
Okay.
So it's also with your medication. So with your medication, you have to limit sun exposure.
Gotcha.
Because it,
Yours too?
yes.
Oh, wow.
Yes. So summertime, I got my umbrella, my UV umbrella, and I am lathered in sunscreen. I
Okay.
carry a fan everywhere.
Girl, thank God you already chocolate, because when it comes to
Listen.
summer, girl, I'm out
Me too. Me too. I'm laying outside.
trying to get as
That's
brown
the
as I
hardest
can.
part, though, because I
Need it.
like to get more chocolate.
Yeah.
What you mean I can't go outside?
Yeah.
And I'm like, outside is healing.
Yeah.
Like, come on. Like, I kind of felt like it was taking a lot of my joys away,
Yeah.
right?
Yeah.
So I've had to kind of navigate the new joys in life, right?
Yeah.
Like, things look very different now, but I'm not going to allow lupus to like
Take over.
take over who I am as a person.
I'd
So
love to hear that.
what made you want to start the Instagram page? Was it just like, I'm just trying to express
Well, first off,
myself?
can you tell us more about the Instagram
Okay.
page?
Yeah, because we keep
Yeah.
hearing you say.
Sorry.
Yeah, it's like it's really elusive.
The new Instagram.
Yeah.
She has her own Instagram, and so her, you know how people get new Instagrams for stuff.
Yeah.
It sometimes will pop up.
It pops
That's what
up.
happened.
Okay.
Yes.
So is it based upon
Yeah.
your journey?
It is.
Oh,
Okay.
So
So you can say your new Instagram. Your new
Yeah,
Instagram.
that's what I meant.
Okay, okay, new.
Right. It's for those who need to know. It is my journey.
Okay.
So I wanted to make it separate from like my personal Instagram, right? And so my new Instagram is really just a healing journey for me, but for other people as well. So I'm sharing the good, I'm sharing the bad, right?
Good.
Because I think
Okay.
sometimes we present a shell of a person, right? And we present just the good to people, and everyone thinks, they look at you, oh, your life is just great.
so
Yeah.
great.
Right. But there are some real things that I am going through, right?
Yeah.
And struggling with. And for the longest time, I was embarrassed, to share my story. I felt fear, shame, all of these things, because
Yeah.
I felt like
I'm sure
people,
isolation.
right, they
Yeah.
expected a lot from me, and I felt like I wasn't, I guess, living up to those expectations, right? So
People as in the general public or people like your family?
I think it was just a mix of everything.
Okay.
Yeah.
Okay.
But I think more so was me than what it really was. Like,
Right.
I was doing a lot of probably self-sabotaging, And so I'm like, I can't keep this to myself. I need to just tell my story, right?
Yeah.
And so that is what I'm doing on this page. I'm sharing every probably not every part of me, but I'm opening people up to, those hard things in my life. And it has been a great journey.
That's
And
so good.
yes.
Would you like to share the page with the
Yes,
audience?
of course. It is J Echoes. So J.Echoes. You can find me on Instagram. I'm currently taking a hiatus right now.
Okay.
Sometimes you need a good break
Listen.
from social media.
Yeah.
Having surgery it took a lot out of me.
Yeah.
The
Yeah.
recovery was very long. It was a very, very long, tedious recovery. So I took a little hiatus, but that's my little safe place,
Yeah.
on the
Nice.
internet.
Yeah.
Where like, I don't care what you think. I don't,
Yeah.
it does not
This is your
concern me.
truth.
Yeah.
Which is
Exactly.
good because you have to be strong for that because some people do care about what people
Yeah.
think from the internet.
No.
Yeah.
So
I'm just like me and my under 100 followers. But you know what?
I mean, you'll definitely grow. Yeah.
I am,
Yeah.
it's not about the numbers for me as much as it is, if I can just touch one person.
the message
Yeah,
too.
it's the message.
Because also some people don't know. Like I wouldn't know
Yeah.
what to be getting tested for
Yeah.
if I was trying to figure out what I had.
Yeah.
And that's the real struggle because when they keep saying you're healthy,
Right.
you don't know to go in there unless you start going down the rat race of what the lady
Exactly.
said, get off Facebook.
Yeah.
And you want to get all these random tests because this is
Yeah.
what so you don't really know what to go in and ask for. And sometimes they don't. But outside of like your journey, like medically, for me, it was more so to say nothing is wrong and just brush it off. Now, I received that nothing is wrong because, of course, like the way I was raised, being a Christian,
Yes.
I'm not going to be speaking stuff over myself
Yes.
either.
Yes.
So I'm going to say, hey, I'm good, but at the same time, like I was telling my mom when I was having this conversation with her, is God provides healing, whether that comes in the form of medication or supernatural.
Yes.
I'm going to be healed. So finding answers to things that I go through is more so for me so that I know how to deal with it.
Yeah.
Because it could be something like, for instance, if my stomach's hurting, well, girl, you shouldn't have ate that cheese, but you
Yeah.
did. Or is your stomach hurting because it's inflamed, your intestines are inflamed? I don't know.
Yeah.
So at this point, I've been going through a health journey, which comes to find out that I don't even have what they diagnosed me with.
Yeah.
And then when I'm like pushing, so they diagnosed me with something, like basically intestines related. And then I questioned it. So I got the extra testing done. And then it came out that there was nothing. What is your solution for this? Because you said get these testings, extra testings, and then I would know. So
Yeah.
I have. Now the testing says nothing, and you're still saying it's something. So I said, that doesn't make sense, because how do you fix it if you're saying that it's something, but the testing
Because
is
it's
showing?
inaccurate.
Yes,
Yeah.
like it's too. So she finally was like, I'm going to refer you out because I want to get you to a specialist, which is the best thing to do. She was really good because I have been trying to get answers since 2018, and I don't understand why we're not believed
Yeah.
when we say there's something.
Mm.
That's like a hard part for me to understand. Like, why do I have to go in there? So now I go in there and exacerbate the pain.
Yeah.
It's 100 out of 10. I'm hurting so bad because they won't
I'm
listen.
hurting so bad.
Yeah, they won't listen unless I say that.
Mm.
And I noticed when I said that, I got results. They tried to give me to how they send you to a PA
Oh
or
yeah.
like
Yeah.
a nurse
NP,
practitioner if the doctor you want is not available. So the doctor I got was very hard to get to. But my gynecologist referred me to her. So I'm calling, got in, and they kept giving me like the nurse practitioner, and I'm like, I don't want another nurse practitioner.
Yeah.
Give me the doctor
Right.
that I called over here for. If she's busy, put me on the schedule for when she's next available. So she's like, all right, I got to call you back. I got to ask her, is she accepting new? She got me in like the next week.
Girl, that's a blessing because my PCP, she retired. I mean, she didn't retire. A lot of these people are going into like private practice, like
Uh-huh.
concierge doc. So that's what I think she did. I'm trying to get in with this doctor that came highly recommended. Like a couple of women in my office go there. I've been on the waiting list since October.
Oh.
I thought that they had forgot about me on missed call. So I called them and I'm like, hey, I was on the waiting list, blah, blah, blah. I called them in February. They were like, yeah, you're still on it. I ain't got a call yet. We're going into.
And see, I had to get referred. If my gynecologist didn't refer me, I don't think they would have. Because I said, I'm not calling to get a nurse practitioner
Yeah.
and a physician assistant. I was referred over here. Give me the person I was referred to see. Because when you're showing results, like, okay, this is what happened to me, and they don't even want to see it.
Yeah.
That was a problem.
Yep.
Yeah.
And so I'm like, and then I go in, and you know how you do all the screenings, like, hey, do you smoke? Do you do this?
Yeah.
Do you drink? The lady, you got my stuff. She's going to say, okay, so do you smoke weed?
No.
I said,
Yeah, I smoke all of it.
Yeah,
That's
like
what you should have
did
said.
you review my
That's what you should have
paperwork?
said.
So now I'm instantly annoyed
Yeah.
because what you did was you looked at this Philippians 4:13 and now you're judging based on a tattoo. Because I literally saw her eyes look at it, and then the first thing she said is, do you smoke weed? That was one of her panel questions to tell me why my intestines are hurting, like my stomach's hurting. So I'm like, no. You have my paperwork.
Mm-hmm.
And now I'm coming off as now I'm just, mean. And, when I'm confused as to why that's a question. Do I
Is
look
that
like
really
that?
a question though?
Right.
Or is it just, do you smoke?
She said, "Do you smoke weed?" She didn't even say, "Do I smoke?"
Because I've never heard anyone ask you, do you smoke a particular thing?
She
Yeah, they
said,
don't.
"Do you
They
smoke
don't.
weed?"
Mm-mm.
Verbatim.
Nope.
And I said, but I think what she was trying to do is, okay, maybe her paperwork says she doesn't smoke. Maybe she does smoke weed. And it's like, girl, don't get slapped in here.
Mm. Mm.
Because that was my, and this is why we always have to be like careful how we're in rooms,
Yeah.
just
We
because
do.
of these stigmas
We
that
do.
people
Yep.
place on us. But at the same time, would you have asked the girl with, 20 piercings, she come in here and her husband smells of smoke, would you have asked her that if it's a white girl? Maybe not.
Yeah.
And I don't feel like we should be looking at somebody and assuming something about what they do outside. So I was annoyed and offended because no, I don't smoke weed.
Yeah.
And you literally pulled that from nowhere. And then that was the same one that didn't want to look at the pictures when I was trying to show her.
Mm.
So that's who they was trying to give me back to after I did my first testing. And I said, oh no, never again.
Yeah. And it's rough because it's like it's already a high stress time. You're going through these symptoms. You don't know what's going on. You're stressed out about that. And then you have the stress of trying to find a doctor who's going to listen to you.
Yep.
And then having to find a new doctor. Like it is such an exhausting, daunting process.
So daunting.
Yeah. So
And frustrating. And it's like, why do we have to go through this?
yeah.
But then you get to people where this is why people don't go to the doctor.
Yes.
Yeah.
To avoid having to deal. They rather just be in pain at home and it turns into later on they didn't go, so now it's something serious.
I'm not gonna hold you. I can't do that though. I
can't
respect the
either.
folks, but I got to go to the doctor.
Same.
'Cause
I
the
am
stress
gonna
is gonna
go.
get to
Yeah.
me. Like
Yeah.
and my thoughts run away with me. I'm a thinker already. So then I just go worst case scenario.
Yeah.
And like especially like with the breast cancer thing. Like I've had like one of my closest friends, she, had breast cancer. Thank God she's in remission. But like I was having pain in my boob and I was like,
Instantly,
okay.
like,
And
this
then
is
I
not
had to,
normal.
yeah. And then it was like
Mhm.
lingering. I was like, oh no. And like even with that, so I had a breast reduction in 2007. So I was supposed to get a mammogram a year after like my surgery, but I never got it. So I was like, okay, let me get a mammogram just to make sure everything's good. They told me, yeah, it's 4 months out. I said, if something is wrong with me, if something's going on, 4 months of progression time,
Yeah.
that can be make or break.
Yeah.
It can be. Yeah.
I had to wait that long for my appointment.
Yeah.
It was so insane. Thank God nothing was wrong, but I couldn't believe it. I'm like, if something is really going on and say it was aggressive, that could be life or death.
Yeah.
Right.
Yeah,
Yeah.
true.
Which is nuts to even think about.
Yeah.
And see me, I call another doctor. Get me in somewhere. I'm going to the ER. Something.
No, I was literally calling all the facilities and they were like, yeah, it's just a wait.
And they're so nice.
And that's how they be on the phone.
Okay.
Yeah, it's a wait.
Hi.
Because that's literally
girl.
how it was
No, I would've
when I was
just
calling
went to,
about my
like, a-
PCP. I'm like,
Let me go to the
so
ER.
can you give
Yeah.
me like an ETA on the wait list?
Not
Like,
a ETA.
she was like, no.
Why you keep
I was
these
like,
nonchalant people?
yeah, okay.
Look, Ashley, like, all right.
Yeah, literally that's how I was. I was like, okay. So I was like, should I just call back? Yeah.
When?
I'm like, I've literally been on this. I went back and looked. It was October 10th that I called and got put on that wait list. And we are now May, what is it? 8th?
Yeah, May.
No, May 6th. It's May 6th. Still ain't got no call.
That's crazy.
Well, girl, that doctor must be coming highly, highly
Yeah.
recommended.
I will say everybody that they speak about her, like, she's great.
That means she
she's
probably
down
don't
at,
lose patience either. She
yeah,
probably
she's
keep her
high
patience.
retention.
Yeah.
Yeah, and she's young. She's like just recently graduated.
I love the young doctors.
Yeah,
Yes.
but everybody speaks
Yeah.
very highly of her. She's down at MCV too.
Okay.
So
Okay. Yeah, I love
Yeah.
I love a good young doctor that
So we'll
listens.
see.
My PCP in the same practice, I don't care. The guy I go to is not a doctor. He is a physician assistant.
Mhm.
I stopped going to my doctor because he was older. When my sister passed, it was like, you can go back to work.
Mm.
Like, yes, I can go back to work. That's not what I'm asking you.
Right.
What I'm asking you is you're giving me medicine to, like, I guess, I don't know, I call it masking whatever I'm really feeling.
Mhm.
it's not going to work long term.
Mm-mm.
All I was asking you is to write me out for, intermittently,
Yeah.
so I could, when I'm not able to go, I don't have to go. Now, granted, the job I do, I don't have to go anyway. It
Yeah.
was just as a precaution, just in case I'm not doing my work. But at the same time, he's like, 2 months should be enough. And you only can be out for 3 days a week. So now you're going to put a time limit. Now, maybe if I was white, you would have
Wrote
been
you
like,
clean out for
yeah,
months.
we can put you out for 5 months. No worries. Do what you got to do. If you need anything else, come back. So I switch. I don't care if you're in the same office. I'm never going back. The guy I go to is our age. He listens. When I say listens, he's not like, if you say, okay, this is what I've tried, this is the medicine that I heard my friend has. He'll say, okay, let's see if it works for you. Because what do you have to lose? That's how I look at it. If you do my test results and my blood comes back and I can take a particular thing, how is it bothering you?
Yeah.
To just say, here, I'm going to write it for you.
You just made me think about, I went to Patient First, and my doctor is actually a Patient First. It's a guy, a white guy. So this particular day, they did not give me him. They gave me a young Black girl. I had a whole full-on fucking sinus infection.
Oh.
This motherfucking girl, forgive me for getting the cursing because it pissed me off so bad. Because I knew what I had. I get them so often. I know what's wrong with me. She gave me nasal spray and some other pointless medication. And I'm like, are you going to give me the Z-Pack? She was like, no, we're not going to do that. We're going to do this. This should work just fine. Y'all know I end up back there.
And
Like,
that's the thing.
I
feeling
was
like
so
it's a money
inflamed. Like,
grabs.
all the heat. When I come in there and he'll look at me, Miss Burlock, what's going on? I'm like, that chick over there, she told me I didn't. And he said, you have a sinus infection. He said, and I said, I know what I had. And I told her, I get them often. This is who see me. She gave me nasal spray. What the other medication she gave, y'all, it did nothing. I was miserable. It did nothing. And this was and I was so disappointed. I was like, you're supposed to have my back. Like,
Yeah.
young Black girl.
But I feel like it's like that a lot at urgent cares. Period. They
I feel like
She was
they're
also
just trying to
new.
get
She
you in
was
and out.
also new, though. She was very new because I go to the one in Chester. It's the doctor that I see all the time, which, like I said, he's my PCP. And then it's another guy that I would see as a secondary. I have no issues with them.
Yeah.
When they look at me, they're like, hey, yeah, you're right. You have a sinus infection. This is going on, whatever, whatever. Even when I went through the situation at work with watching the dog situation.
Yeah.
And they, was doing all my workman's comp stuff. They gave me no problems.
Yeah.
Nope.
Some of them are really good about it. Some of them are. And some of them are not. Some of them are like,
Hence the reason why I go there. I wouldn't go there if I didn't feel this one doctor, when I say he listens to everything I have to say, anytime I go in and something is going on, he is dead on.
Yeah.
He's dead on. But I was shocked. I was looking at this girl like, what? And she was like, yeah, and then if you have to, I think she gave me like a backup medication. Everything she gave me was all wrong.
Yeah, I could see that.
Yeah, I do feel like that happens a lot at urgent cares.
A ton. Or just sometimes doctors be trying stuff out, I feel like, for kickbacks or whatever else they get there. Like, oh, we're going to try this medicine that this pharmaceutical company just brought in here, and we'll see. Tell me what I was on birth control in 2012 or 11, something like that. Anyway, it was making me angry. And I went back in like, I think I'm angry when I'm taking this. And they were like, my doc's like, oh yeah, I heard that before. I've heard that from people that's on this. So why would you put me
Oh.
Yeah, why didn't you just tell me? Yeah,
hey, this could
It's like you're a lab rat. That's what we be. We be lab rats for them.
I feel like it was. Like,
Yeah.
And at that point, also, it was also making my body, I only have my menstrual cycle 2 days anyway. I was having freaking 5 days. I was annoyed. 5 days when you only got 2 days? Oh no. I'm like, let me get on up off of this because it ain't for me.
Well, I'm the opposite of you.
Wow,
I've always had them long ones.
Yeah, I've never had long ones. It's always been 2 days.
Hate it.
And I love that.
Oh my goodness.
You only off. As soon as you get on, you basically off.
I'm like, wow, you're off.
Like, oh, you thought you were? I was. Not anymore.
Wow.
Yes. Yep. So we didn't get into men a lot because obviously we're women and we don't really
Yeah.
know, but we do have brothers and your
Yeah.
husband and your husband and men that we've dealt with.
Mhm.
I see it frequently. They don't go to the doctor as much. And when you're with them, if you don't make appointments for them,
They won't go.
and I don't know if it's just a lack of like, I don't want to have to look. I don't know where to go. Like, I've asked, my brothers were talking about this because we were just quizzing. Like, where do men go? Where's their gynecologist, technically? Technically.
Yeah.
And they wouldn't know that supposed to go to urology, but that's where you should be going. And
Yeah.
it's like, but there's not enough education on it because who's going to tell them, hey, you need to go to the urologist to check on this? They go to their PCPs to get, regular stuff. But like, I feel like it's not enough education about it. And then I think some of them have indirect white coat syndrome too.
They do.
Yeah. I mean, I feel like it's fear around all type of doctors because it's a lot of people that's afraid to go to the dentist. You know how I feel about teeth.
Yeah, we know how you feel,
Same.
sis.
I
We
feel
know
the
how
same
you
way.
feel.
I don't play about teeth, and I know a lot of people who's like, I had a bad experience, and then they just never go back.
I
Either.
think it's just men and being stubborn.
Does your husband
That
go to
could
the
be
doctor?
that too.
He does.
Do
Oh,
you
good.
make the appointments?
No.
Oh, never?
Good job, girl.
Right.
No, I have not.
Okay.
So my husband also deals with an autoimmune disease.
Okay.
So I think once he kind of went through that, it kind of woke him up.
To
Okay.
go on his own.
Yeah.
and
So
calm
if he
it.
coughs too hard, if he, whatever it may be, he is on the phone making appointments.
Okay.
Oh,
Good for him.
Good.
Good
So
for
I don't
him.
have to worry about that.
He's
Yeah.
rare.
Right. Well, I'm
He's
like, I
rare.
need you here. Like, I can't do this without you.
Yeah.
here,
Yeah.
So I think he's just more aware, like, my family needs me in good health in order to keep this house moving.
Which is good.
Yeah.
Well,
So
that's a
I'm
blessing.
Good. They need both.
They need
both
us.
of y'all.
Right.
Yeah.
Exactly. In good health.
Yeah.
Yeah.
And the crazy part is I used to be like, men only gonna go to the doctor after they got an STD. And it's either because the girl came and told them they have an STD that they probably gave the girl.
They felt a little
or they
something.
felt a little something and now they're going. Outside of that, ask them about their PCP and they probably don't have one.
Yeah.
Unless they have something from childhood like asthma or something like that, they might go to the doctor because they need prescriptions for the medicine. But a lot of them don't go. And then when they do, I will say this. One of my friends said her husband went and they kept sending them home. Like, he's like, something's wrong. My stomach. Kept sending them home. Finally, he went back to the hospital and he had to do emergency surgery because his appendix would have bursted.
That happened to my brother.
And he could have died. That happened to my brother too. But my brother was a child, so he was just saying his stomach hurt. They didn't turn him away, but they will.
No, my brother went back and he was like, no, y'all need to listen. And they found out, that he had to go into surgery and because it was on the brink of bursting.
Which is crazy.
And it's like if you don't speak up for yourself, they'll have you out here dead.
Yeah.
And wake up dead.
That's the thing. And
Wake up dead.
that has happened to people. And I just find it crazy. I don't know what men's thoughts are about why they don't go. I guess I could ask my brother and brothers and see why they don't go. My brothers go, but my brothers go because you're also around females that are like, hey, we go to the doctor, we get checked. But like for stuff like say they hurt their arm or something, they're not going.
Oh yeah.
They're not going. Like I just hurt my arm. It'll be all right.
Yeah. Arm dangling off.
Yep. It'll be all right.
He'd have did that. He'd have had a cut he had got playing. It's outside playing or something. Cut his arm wide open.
And didn't want to go to the doctor?
Didn't go nowhere.
Oh, he didn't get
You didn't know?
No.
Oh.
This type of stuff I was dealing with. I had no clue. And then one day I just happened to look at his arm and I'm like, Peter, what happened? Mom, you remember that time? I actually don't remember that time.
Wow.
I actually don't.
Like, okay.
But he was old enough to be able to probably hide it from me, or that was like high school, I believe. But men, like you said, men, boys, they don't do the doctor. He came to me one day, he said, Mom, I'm in pain. His neck was a knot here.
Oh yeah, you can't be playing games with that.
He said, Mom, in pain. I was like, all right. So I'm like, where can I take him fast? I take him to that Chester Bon Secours up there in Chester. The new one?
Yeah. They suck up there.
They suck ass.
They're bad.
Okay. I took him in there.
Don't go there.
And I hate, and I remember the doctor's name. When the doctor came in, I said, this is not going to go well. The doctor's name was Dr. Salisbury. He was chunky. He was chunky.
Dr. Salisbury getting all type of shots.
Listen, he was chunky and his scrubs were kind of tight. His scrubs was kind of tight. Yeah, it was. So when he walked in the room,
You said,
me and my kid, me and Peter, you know my kids are so unserious.
Yeah.
I said, Peter, I think that's the man. His name Dr. Salisbury. Peter said, Mom, stop playing, man. He walked in. He said, hello, I'm Dr. Salisbury.
Wait,
Peter
that's
said,
his real name?
Yes.
He's like a Salisbury Steak.
Yes.
Oh.
Peter said, bruh, like. So I said, it was something going on with his throat. He had this knot. That man gave my baby ibuprofen and magic mouthwash.
what?
And sent us.
Oh
Didn't
my
do no
gosh.
testing?
So I'm like, this can't be right.
Mm-mm.
So we went home. And I don't know whether I was giving him pain or whatever. I want to say a day later, it just didn't sit right with my spirit. And it was the weekend. So I took him to Chippenham.
Mm-hmm.
I get in Chippenham and they see him and I'm telling them the symptoms and everything. The triage nurse says, send him right back. They send him back. They said, we got to call the doctor now. He had an abscess that was blocking all this back here. They had to call the doctor from home. The doctor came in and had to cut and drain all this stuff out.
Jesus
Yeah.
Christ.
So I'm thinking to myself, y'all know when the abscess bursts, that can like put
Yeah.
all that in your body.
Yeah.
In my head, I'm like, oh my God, that ass almost killed my child.
Yeah.
I was pissed.
Salisbury almost.
I was so pissed. Y'all know that was the last time I went to that place.
I believe it. That
Yeah.
place sucks.
Yeah.
I'm like, what in the world? This baby had, it was a knot on his neck. And I was like, what? When he came in my room, I said, what happened?
And
He's
it could
like,
really be anything. It could be thyroid, anything. And
but
you can't play with stuff
Chippenham,
like that.
when I say they moved so swiftly, as soon as I got in there, we waited we made it a little bit of time. But once he got to the triage nurse, it was a guy. He said, oh, absolutely not. Send him back. Send him back. He knew immediately when he was looking at him that something serious was
not
going on.
normal anyway.
And they were like, we're getting on the phone right now. We have to call the doctor
Yeah,
from
to have a
home.
mass on your neck, I will say I don't really like Chippenham. They've always,
Give me a bad experience.
yeah.
And you know that if you do
It's
have a
funny because
bad
all my kids were born in Chippenham.
They do have an advocate care place at the hospitals that people don't know about. When people do you wrong at the emergency room, you can go and talk to those people.
Yeah.
Now-
Like one time when I was with my ex, like he was like, I'm having like severe back pain. And so I was like, okay. So we went up to the ER. You know, first off, it was Chippenham. They take forever.
They do take a long time.
So we were in there maybe an hour and a half, almost 2 hours before the doctor comes in. So the doctor comes in. He was this young white guy. And he's like, I'm just having severe back pain. Like it's distracting. Like I really can't like move around without feeling pain. And so he's like, okay. He listened to him breathe. And then he's like, yeah, you probably just have like a back strain. You can take I'll give you some ibuprofen. And that was it. And he walked out. And he was like, we'll write the script up. It was like 45 minutes later. I'm like, where is he at? So I walk out and the room was right by the like nurses station. They all over there laughing, Kikin. I said, excuse me, are you gonna get the medication? And he's like, oh yeah, I'll be there in a sec. I was so
They're
over
bad.
it. Yeah, I'm like, you didn't check anything. Like, it could be his kidneys. You don't know what it is. He's saying he is having severe back pain. Sometimes it's not just muscular.
Right.
You didn't do
Yeah.
any type of
That's why I
investigation.
thought
And
about
it don't seem
Salisbury.
like you asked.
Salisbury made me feel the same way. Y'all think I'm joking? Go up there. Go up there with a minor issue and see when that man come up out of there. Like I said, he was a kind guy. He was kind. He had good bedside manner, but he didn't check anything. And I'm like,
Yeah.
did you just get? And when I saw it said magic mouthwash, I get to go. I said, you just gave him something to numb the back of his throat?
Yeah, that's
yeah.
crazy.
Why do we think that preventative care is not as like prevalent in communities or our culture so much? Like telling us to go, like I was just saying with the men not going because they don't know where to go. Why do you think we're not getting that type of education? I think we are now because the social media has like ramped it up and people are like getting fear mongreled or whatever you call it.
I mean, it also depends on like how you were brought up too. Like if you didn't go to the doctor as a kid, your
True.
parents weren't taking you to the doctor, it's probably not that important on your list to go to the doctor when you get older, you know, unless you have things going on.
That's true.
So I think you have to be shown something like that. Because I mean, it's easy to go through your day to day, especially if you feel fine, you
Yeah.
know.
Yeah.
Like a lot of people aren't thinking, oh, I need to go to my yearly checkup to get a physical, you know, biannual teeth cleaning. You know, as a woman, annual.
She gonna mention them teeth.
She gonna mention it. I ain't mad at
I'm
it.
sorry, that is a
That
doctor
is
that is
true.
imperative. You need to
Yes.
be getting them gum. People don't realize that gum disease can lead
Yeah.
to Alzheimer's.
And you and your teeth will fall out.
Yeah.
Forget the teeth part. Get you some dentures. Your brain, it can affect your brain. Like, I'm like, it leads to other things. People don't realize that it can be a preceptor for something else.
It could.
So it's like outside of you just having bad breath and tartar on your teeth, it can cause other issues. Just like you have decay, you can get abscesses.
Yeah.
And those things are not easy to deal with. Like, they can be very painful. And if that pus and stuff gets into your system, that can cause more issues.
Yeah.
So I'm like,
Yeah.
it's important for you to take care of yourself.
Yeah.
That's a part. People don't. That's a part of self care.
Yeah.
Yeah.
Go to the doctor.
That's true. So maybe some of us are the problem.
Oh,
Maybe
absolutely.
it's not just us going to the
No, it's
doctor
not
and
just the
getting
system.
turned away.
It's the people themselves.
I mean, the
Yeah.
system's bad
I would
too,
say
but
my
yeah.
son, he is definitely the problem. Because when I saw that cut on his arm, I'm like, bro, what? Yeah, it won't nothing. It bled a little bit.
Yeah.
Nigga, it didn't.
And then there's
it
just
looked
some
like he needed
men,
stitches.
yeah, like manly
Yeah.
men, like, because, you know, I work in workers' comp, and like a lot of them country men, like this man fell off the truck, his thumb pretty much broke off his hand. And then he broke a couple of the other fingers. And he was like, honestly, like I wouldn't even file this claim if it was just the 2 other broken fingers. They would have just been fine. But, you know, my thumb's really messed up. They had to do a fusion.
What
They
the
had to-
hell?
yeah.
I believe it. We hear it
Yeah,
all
where
the
they had to
time.
fuse his thumb. Like he can't even move his thumb anymore because they had to fuse it. So it's literally screwed onto his hand because it had like ripped off.
And a lot of them
And-
wouldn't file claims if nobody was pushing them to do it. They
Yeah.
would just be like,
And those be
whatever.
the ones that's really injured.
Yeah.
Then you got people with a paper cut and they file
They're
a
like,
claim.
oh, let me get this claim in. I
Yeah.
done cut myself with a
The
piece of
paper
paper.
cut.
That's
Then
a
you
real
get an
thing.
attorney and you trying to get a settlement.
Right. For a paper
Well,
cut.
paper cut.
But for real.
That's neither here nor there. We're not going to go into the ins and outs of it.
But yeah, I also think we have to do a better job of speaking up. We do when we go to the doctor, but like being persistent is a thing. Like we can't just let somebody turn us away and we just take it for face value, because I feel as those are the times when you really need to be speaking up.
Yeah, you
Like,
have to advocate for yourself.
Took the words out of my mouth. You have to advocate for yourself, but you also have to pay attention to your body.
yeah.
Mhm.
You can't
Yeah.
say, hey,
And
this
some
is hurting, this
don't.
is hurting,
Yeah,
this
some
is
people
hurting,
don't
and you
even
don't
pay
get it
atten-
checked.
yes.
It doesn't make sense.
Yeah, some people don't pay attention to like things going on with themselves.
And some people pay a lot of attention and they're hypochondriacs, but I'm not mad at those people because they oftentimes get results when they're
Yeah.
like that.
Yeah.
But I do think in general, healthcare in our culture as African Americans is something we need to stress more of. The population of Black doctors is low, at least in this area. You go to Atlanta, you're going to find some.
Yeah.
And that is just now I'm not going to say all doctors know what they're talking about, but I also think people got to stop trying to be so I'm pro Black doctor. So I'm not going to the doctor because they're not Black.
hmm
You need a doctor.
Yeah.
Doesn't matter what color
They
they
need to be a
are.
good doctor.
Yeah.
Yeah, I
there
just need
are
a good doctor.
ones.
Yeah.
My OBGYN is a white lady.
Right. Mine too.
So,
And it's referrals. Talk to people you
Yeah.
know. They'll
Yeah.
tell you,
Yeah,
oh,
like
don't go
my
there.
new GYN I got referred to
Mhm.
by my friend. I mean, she's Black, but she's great.
And also, we got to get off social media looking at health results.
you get on
I
social
agree.
media, it's just like getting on, it's like Googling a WebMD. You think you about to die tomorrow.
You're always going to have cancer when you're on web.
Yeah.
WebMD.
Yeah. Immediately.
Yeah.
Stay off.
And AI. Stop letting AI tell you what's wrong. Now, AI does a good job of reading your medical results. They're pretty accurate
How do
with
you
that.
know that? You did you use that?
Yeah, I put it in.
Oh.
'Cause you know when they do blood work, before you get a result from a doctor, I'll just plug it in and say, hey, what does it look like? And they're like, you look healthy, you're great. However, I will say this. They are reading what the doctor has inputted. It's not like they know like something else that could be that maybe you
No,
need to check
I
this or check
I
that.
figured
But
that
yeah, they
there.
definitely will give you the results. And I've used it.
I bet you have.
Mhm.
The only thing I've
So
done, I've looked at results before and something that makes sense to me, and I just Google it.
just Google it.
Yeah, I'll
Yeah.
Google.
I ain't
But
never put
Google's the
it.
same as ChatGPT.
I know, but I've just never
Actually
used
better. It hones in on
ChatGPT.
that specifically. And it's like,
I just haven't gotten on the AI wave yet.
Well, AI is actually saving me. I mean, this ain't got nothing to do with it. It's saving me when it comes to how I respond professionally, because I feel like my emails will come across the same way I talk right now,
okay.
which is not good.
Mhm.
So what I do is I will type in, I'm sending an email to such and such, and this is what I want to say. And
Yeah.
they make it sound so
I
professional.
mean, it is good. Yeah, it is
That
good for
type of
things
stuff
like that.
I use
Yeah.
it for.
But some people
That's
use it
good,
for
though.
like every single thing.
And you can tell. Like,
Yeah.
what shoes should I wear? Like, okay, you don't need AI. Just like, I mean, I don't know. I
You
think
can tell
AI is
because
great.
when they open their mouth, you like,
So wait a second. Right.
Like, like we know you used AI for that, but
Mhm.
okay. But all in all, we gotta do better at
yeah.
going to the doctors. That I think as a woman, you should have at least 2 doctors.
Mm-hmm.
And your dentist, so 3. And I think people also forget, like she said, you do need to be going to the dentist every 6 months.
Mhm.
It's not optional. That's why they tell
It's optional
you.
for a lot of people, and that
A
is
lot
what
of people
bothers
make it.
shakes me to my bones
to your core.
because I just don't do nasty mouths.
It's just
And I mean,
not.
there's some people who brush their teeth. You know, they haven't been to the dentist in years, and they don't have any cavities, nothing. God bless them.
Yeah,
But everybody needs that good cleaning.
yeah.
I agree.
A good
Yeah.
cleaning, a good just let somebody look in your mouth, get a good X-ray.
Yeah.
Yeah,
You just never know.
yeah. Because I mean, even my nephew, his tooth was turned. His wisdom tooth was turned
Mhm.
in his mouth. Wouldn't have known that. His teeth were fine. Nothing. He wasn't in pain.
Yeah.
But when they did the X-ray, they saw it, so we got him removed. But
Mhm.
I think also with healthcare, sometimes in the African American culture, people relate that to their religion.
Mm.
Oh,
So we
yeah,
don't
sometimes.
go. We pray,
Mm.
and we should be praying. I ain't gonna lie, but
We got to do both.
you need to
That is so
let
true.
God use the doctors to help.
Because they were put here for a reason.
They
God
were.
gave them their gift or
Yeah.
whatever it is their specialty
Correct.
is
That's
for a
right.
reason.
Yeah.
Correct. But I know a lot of people are like, yeah, I'm gonna just pray about it.
I believe in modern medicine.
Mhm.
I do.
Mhm.
I do.
But you can pray about it. What's the saying?
I mean, praying over any and everything is
Necessary.
beautiful. Yeah, like
Yeah.
you should have something to center you. I don't even care what it is, but there has to be something higher than you that you find to center you and, ground you.
you
But
still got to go to the doctor.
you still need
And
to be
the
going
dentist.
to them
I agree.
doctors.
Yeah.
Yeah. So,
Yeah. I mean, true.
Yep.
And also, I think we get into praying, and then outside of praying you get into, well, I don't want to speak something over myself, so and I'm not going to share it with you because
Life
I
and
don't
death
know what
is in the
energy
power of the
you're
tongue.
putting to it. So then we end up being private and isolated with something that somebody might have been going through the same thing, and they could have easily just told you
And
what it
that's real.
was.
And that's something that like I struggled with because I'm a woman of faith, right?
mhm.
And so I think talking about my journey and lupus, people saw that as my acknowledgement was accepting it.
Mhm.
And that's not the case, right? I see it as it's a part of my story, but it's not who I am, right?
Mhm.
Mhm.
And like you just said, God, we have doctors, we have medicine, and that is healing as well.
Mhm.
Yeah.
Sometimes healing is not just a miraculous thing,
Yeah.
right? Healing is the medicines that you have, those healing and helping hands.
Yeah.
And so, like I said, it's something that I really struggled with, because people had an idea of what they thought my healing should look like.
Mhm.
But I'm like, the fact that I am here, I'm walking, I am happy, I can do all these things, attest to God's healing in my
Yeah.
body.
Yeah.
Yes.
So, yeah.
And it can
that's
come in
it.
other forms. It seems
Exactly.
supernatural, not just
Yeah.
supernatural. So
Exactly.
I do think that's something that this is why people will say, "Oh, I prayed about it," and it's like,
You
go
got to
to the
do the work
doctor.
still, though.
Yeah, because
Exactly.
faith without works is
Is
for
dead.
dead.
Yeah.
So but I think it was good really to hear your
Yeah. Like,
story
yeah.
and
Very
like
enlightening.
Thank you
give
for
us some
coming.
insight on it. And obviously, I think it's good that you also have started this social media platform so people can maybe get questions answered
Yes.
or go to it, because we do go to Google,
Mhm.
and sometimes Google isn't.
Okay, so I'm wearing a Amazon vest, a H&M dress, and my Travis Scotts, and random jewelry. These earrings are from Aldo, and that's it. Okay, bye.
Okay, so I have on a Guess denim dress, my little baseball cap, Converse, and my favorite little bag is a Coach cherry bag. Yep, that's it. Nice and simple. Bye-bye.
Good. Okay. All right. Because after all of that, I just am going to use this mic. Anywho, I got my sheer cardigan shirt on. I got a little brooch from Shein. I love gold. These shorts are from Shein too. Of course, my heels today again. It's black. There's not any color today, which is not shocking. But yeah, that is my outfit. But we should share if you feel safe. I think it's good to share.
Yes, I
because
agree.
somebody might have went through it.
Yeah.
But I think we are good on it.
Yeah.
Yeah.
So
Thank
yeah.
you.
Thank you,
Yeah, thank you for
Yeah.
coming. Yeah.
So if you like what you heard, like, share, and subscribe.
Bye, guys.
Bye.
Hey, we're so glad you're here. Make sure you like, share, comment, and subscribe so you don't miss out on the good stuff.